Good afternoon. I'm Jesse Tischer. I'm the incident commander for our COVID response here at Aspirus and the senior vice president and president over our regional markets. Thank you for joining us today to talk again about some of the very important steps we're taking in the fight against COVID. We were all very excited to hear about the FDA's advisory committee approval and recommendation to the FDA for the approval of two different COVID vaccines, and we at Aspirus are just really excited about that. It's been reported that many of the major approval steps through the FDA and CDC will occur over the weekend. We at Aspirus will be ready, continuing to prepare for that announcement as it comes out over the weekend. I do want to say that this is not going to be an instant solution to the COVID challenge. It is going to be another weapon in our fight against COVID, though. It's important to note that there are many unknowns in the fight against COVID, but we have been planning for the last several months for this, and Dr. Susan Schneider will be able to speak to some of that in a few minutes. One message that I would like to share with everybody is that the basics of COVID prevention that we've all been practicing for the last many months are very, very important. Continue to socially distance when able. Wash your hands. Wear your masks. The vaccine, again, like I said, is going to be one of those weapons that we use in this fight. Those other aspects are also tools that we will use. One other thing that is important to note is that in Wisconsin and Michigan, our COVID positivity rate does remain very high, and we need to remain very, very vigilant to making sure that we continue to drive that down. So since this pandemic started, we at Aspirus have been very much engaged in making sure that we are prepared to be the leader in the region and acting as the leader in the region through education, consistent and transparent communication to our entire audience. Again, during that time, we've used all of the weapons at our disposal to help manage and react to the virus and the fight for that against that virus. We've implemented community-wide testing and education, and at Aspirus we've tested well over 115,000 people in the communities that we serve. We've helped businesses open safely through our Work Well program, and that has helped enhance the viability across our region. Very early on, over 60 days ago, Aspirus worked with federal resources to bring in disaster medical assistance teams, and those teams we used to enhance our ability to expand volume and use that time to prepare for caring for additional patients in different ways across our system. Early drug approvals came, and we at Aspirus took advantage of that and have been able to utilize antibody therapy. In our system, we've already given well over 50 different treatments of antibody therapy to 50 different patients. And we've also been leveraging additional resources like home health, supplemental oxygen, and care for patients in their homes to treat well over 1,000 patients, averaging about 125 or 130 patients a day that are treated at home. And now we've got the vaccine. We anticipate that we'll be able to start that vaccine treatment early next week. Again, each one of these tools has allowed us to combat this deadly disease, but we also have to remember, as we've said before, the basics of masking, washing your hands, and social distancing. Aspirus has been here for the community. We'll continue to be here for the community. We will continue to be a leader, and we look forward to being able to distribute the vaccine, vaccinate folks across our footprint in the days and months to come.
Jesse, you mentioned that we treat 125 or 130 folks in their homes. Do you mean COVID patients in their homes? Because I think we can do more than that, right?
Correct. So Aspirus has treated 125, on average treats 125 to 130 COVID positive patients who are in need of active treatment. We are treating 125 to 130 COVID patients in their homes on a daily basis. So again, Aspirus has worked to stay a step ahead throughout this pandemic. We'll use this vaccine to keep our teams and our communities safe. And with that, I'd like to introduce Dr. Susan Schneider. Dr. Schneider is our Senior Physician Executive for Primary Care. In addition to that, Dr. Schneider is a family practice physician with practice here at Aspirus. Dr. Schneider.
Thank you, Jesse, and thank you all for coming today. As Jesse said, I'm the System Senior Physician Executive of Primary Care. I also am one of the medical directors on our medical branch for EOC, or our Emergency Operation Command, for everything COVID. And we have been following the vaccines very closely, and we now know that the FDA has initially, the advisory committee has given its recommendation for the agency to go ahead and with the emergency use authorization. It'll be some time actually before we do get full FDA approval, but under emergency use authorization, similar to the monoclonal antibody, we are able to go ahead and start vaccinating once that approval is official. There will be several distribution sites around the state that will be receiving the vaccine. Because it has to be kept at that ultra cold temperature, we have been planning around distribution, around transportation, and around storage to maintain the integrity of the vaccine, as well as making sure that we can actually very quickly and efficiently give the vaccine once we do receive it. We do know that we do have to be able to, again, get it to all of our markets in Upper Michigan and all the way down to Portage, Wisconsin. We have been notified that we will be able to receive our vaccine in Michigan as early as next Tuesday. We have not yet heard definite dates for Wisconsin delivery, but anticipate sometime next week also. The second vaccine that is going to be reviewed is the Moderna vaccine, which we understand will actually be released within the next week or two, so fairly soon. The distribution of that vaccine, because it does not require the ultra cold temperatures, will actually be distributed right from the manufacturer to the clinic sites. We have been working on a plan around the COVID vaccine for weeks. We have been in planning stages. We have been training. There is still further training that needs to be completed once the official authorization comes through from the CDC. So that can be completed in a very quick manner so that once we do get the okay, we can actually then roll it out to those groups that the CDC is recommending. And at this point, since we know there'll be a very limited amount of vaccine, they are targeting those really high-risk groups. The first groups that will be included in the vaccine include those residents who are in long-term care facilities, as well as healthcare workers, particularly those on the front lines. So those that are taking care of COVID patients on a daily basis will be given the vaccine first. And then as it becomes more available, we will roll it out to the remainder of our healthcare workers, and then on to high-risk groups. The CDC has very strict guidelines on who will get those vaccines and what phases they will be in. The next phase after healthcare workers and those residents of long-term care facilities will likely be really high-risk patients who are at risk for progressive disease for COVID, as well as essential workers. A lot of that detail has not yet been released by the government or by the CDC. Our allocations of the Pfizer vaccine will be based on what the state actually is allocated. We know that, again, that supply will be very limited at the beginning. So those people that are getting that vaccine, again, will need to be prioritized. And we anticipate, though, a steady stream of the vaccine as it is released over the next several weeks. The vaccine itself, again, the Pfizer vaccine is a new vaccine. It's a new vaccine type. It looks like it has actually very good protective ability. We do know that it was recently started to be administered in the UK, so we were watching that information very closely. And we do know that it is a two-part vaccine, so you're not completely protected until the second dose, which is given at least 21 days later. The Moderna is at least 28 days later. Someone who starts their vaccine must complete their series with the same vaccine. So we will actually be tracking very closely all of those employees as well as patients on which vaccine they got, so that we can make sure that they are covered by the same vaccine. We also know that the Moderna vaccine does not need, again, the ultra-cold temperatures, so that will actually be easier to distribute in some of our other smaller locations, particularly in our rural areas. We have taken measures to make sure we have storage capability in those ultra-cold freezers at various locations, and again have determined what sort of transportation and distribution we will need to be able to get those vaccines to the locations so that the integrity of the vaccine is maintained. Once it's out of those freezers, it can only be maintained for 5 days. So once that distribution starts, we will need to get those vaccine clinics up and running very quickly. As Jesse mentioned, the COVID vaccine is really another one of the weapons that we can really use in this pandemic, but it's not the only thing. And as we continue to really leverage as many of the treatments that are out there really to fight this virus and to get through this pandemic, I also would reiterate the fact that we need to really continue to make sure we're masking, washing hands, social distancing, staying home when we can, staying out of large groups. Once you get the vaccine, it doesn't mean that you can't mask, that you don't have to mask anymore. Until we're through this pandemic and we know that we have really kind of beat it, we will need to continue to use all of these methods to really kind of stay safe. Jesse, do you want to join me for more questions?
If you have any questions, and Andrew, watch if there are any here, you can just call it out and.
So you guys talked about you guys do have storage capabilities here. I know the CDC was talking about how Marshfield Clinic would be a hub. How are you guys working with them to get the vaccines into your guys' storage and ultimately out to the people who need them?
So as a health ecosystem, we do work with the federal government very directly. The speed with which we can distribute the drugs is dependent upon a hub and spoke system. So through our what's called HERC, our Hospital Emergency Response Coalition, each one of those HERCs across the state made a determination to where and how can we quickly get the drug across the system. So the way that will work is Aspirus does have ultra cold temperatures, freezers. We've got a network of courier systems, and when the government does distribute to those government distribution locations, the health systems, all of us will be able to access those drugs exactly the same way.
I got one question now. How many doses of the vaccine do you anticipate receiving in the next week?
The distribution or the quantity actually is still unknown, so it really depends on what the state of Wisconsin gets from the CDC, and then the state of Wisconsin actually will distribute that out to all of the various locations. So at this point, we do not know how much we will get. That's why we have to actually prepare again to make sure we know who those high priority employees are and high priority patients. The thing we do know though about the vaccine is that we will not need to hold back a half of it, as the CDC itself will hold back. So if we get an allotment of X number, they will actually hold back that second dose so that we don't have to worry about storing it on location. And then when we get to that cycle of three weeks, they will redistribute it to us again.
You mentioned that Moderna will be easier to distribute in rural areas than the Pfizer vaccine. What challenges are you encountering with planning, transport, and storage of the Pfizer vaccine in rural areas?
We do have, again, as Jesse said, we have a courier system that actually has been, transporting vaccines all along. The vaccine itself actually can be kept on dry ice for a period of time, and you can actually replenish the dry ice. And we have made sure that we have a supply of dry ice, and we have a steady distributor for dry ice so that we can actually get those to the facilities at refrigerator temperatures. Again, it can maintain for 5 days. So. And we have couriers that, even though our system and our distribution area is very large, again, 2 states, we have couriers that are running those routes daily and actually multiple times a day. So we don't anticipate that that will be an issue at all.
You guys talked about how important it was for PPEs during this time, especially, the vaccine is just a weapon. It's not something that's going to solve everything. Have you guys noticed any shortages of PPEs as they continue to be important?
So shortages of PPE are not something that Aspirus has had to deal with, because we've been on top of monitoring our use of PPE, our burn rate of PPE, and we've got an excellent supply chain system that has been able to recognize when we think we're going to have lower quantities, and they restock us. So at this point, PPE is not a problem for us at Aspirus, and we're going to continue to stay on top of it.
And then another question, the rehab director said that they expected as people start to recover from COVID-19 that they would have to go to rehab to kind of work back to getting back to 100%. What are you guys going to be doing with the patients when the 12 beds fill up, since there aren't many places for like an inpatient setting?
Not sure where the 12 beds, but so
Inpatient rehab.
Inpatient rehab.
He's talking about.
So we do know that actually patients that have had really extended length of stay in the hospital actually do get quite deconditioned and need rehab. And we've been able actually to accommodate that so far. We do have multiple other modalities other than just inpatient rehab. We work with multiple area rehab locations in the city, as well as actually in our counties. We also actually have a very robust post-acute care delivery system that includes home health. So we have been trying to really treat the patient in the appropriate setting and really trying to move them back to a home environment as soon as it's safe for them.
Okay, one other question here. How do we plan on notifying the public and certain populations when they can receive the vaccine? Will it be easily accessible to them?
So as soon as vaccines are available for widespread distribution, we would encourage the public to continue to pay attention to press briefings such as this, media responses. We will issue press releases, and we do anticipate having discussions in our local clinics. Have a conversation with your local primary care provider, and again, the distribution of those vaccines will be an ever-changing, ever-fluid situation. So Aspirus, as we always have, will continue to be transparent and get that information out as soon as we know it.
How many facilities do we serve or anticipate would receive the vaccine across rural Wisconsin?
When we get to the point where it's widespread for general population and we're distributing it at all of our locations, we would anticipate it'll be actually at all of our primary care clinics that currently would vaccinate, say, against influenza. So between 40 and 50 different locations, we anticipate we will be able to accommodate that. Now, particularly if we get the Moderna vaccine, by that time, and we're anticipating actually the public, again, general public, won't be in that vaccinating phase until probably sometime late February, early March. We're hearing spring at the earliest for general population. And by that time, actually, again, there may be more than even the 2 vaccines released. So we should be able to get the appropriate vaccines to those rural areas and be able to vaccinate those patient populations just as easy as we would in our urban areas.
I think my last one would be, you guys, you both talked about how frontline workers will be the first to, that are made available to the vaccine. Is that an expectation for some of the workers here at Aspirus? Is it, yeah, so what would that be the case?
Is your question related to the requirement, or is your question related?
Is it a requirement? Yeah, would it be a requirement? Can you require someone to get it, like, you know, that works here? So.
At this point, Aspirus is going to have a program participation requirement, which means we will ask all of our employees to let us know whether or not they want to receive the vaccine, but we are not going to force somebody to receive the vaccine at this point. Depending upon how the pandemic continues and what some of our regulatory bodies may require, we are reserving the right that at some point, if it becomes something we have to force, that we would at that point.